I'd like to introduce you to Medication Administration Assistance. This little program is designed for healthcare assistants who are working in the field who may find that they are now getting extra workload added to their day-to-day business in helping and assisting people with safe, accurate medication administration. What is a medication? A medication is a drug that's used to treat or prevent illness or disease. And as a healthcare assistant, one of your delegated tasks might be assisting clients with their medications. You are responsible to work within your scope of practice and to know the facility's policy and procedure. The guidelines and procedures can vary depending on the facility or the agency that you work for. So it is your responsibility to know what you can and cannot do under that facility or that agency. So the information that you're going to get through this little course is a guide only. It's to help you to assist with medication safely should that fall within your scope of practice in the facility or with the agency that you work. Now, medications are drugs. They're used in or on the body, and they help to prevent or treat disease and illness. And when we talk about assisting with medication administration, we're really talking about helping people who do self-directed medication management. That means they're taking the medication independently for the most part. We can be responsible for assisting those clients with those medications. But again, you need to be sure that it is within your job description under the agency or with the policies of your agency that you're working under. What is our scope of practice? Literally speaking, your scope of practice is what you can legally do or not do under your governing bodies, under the legislation that rules your job. So that could be provincial legislation, territorial legislation. It could be the policy and procedure according to your agency or your facility that you work for. When we look at our scope of practice, we look at assisting versus administering. Now, assisting with medication means that we are helping that client to self-medicate. The client is independent with the use of their medications, but needs some assistance from us in order to get that medication into their body. So that could include things like getting the medication from a shelf that they can't reach, taking a stubborn lid off of a bottle, making sure that they're accurate in their dosage. If they're pouring liquids, we can confirm the amounts that they have, those types of things. This is within our scope of practice. Administering medications is more of a nursing responsibility because it involves actually measuring dosages, getting those dosages into that person's body, monitoring the outcome of those medications and evaluating whether that medication is working or not. This does require specialized knowledge and judgment, and as a result is not under the HCA scope of practice. There are special times when this could be delegated to you as a care aide, and if that is the case, then you have to follow the rights of delegation. So if you are ever asked to administer medication, it is the employer's responsibility and the nurse's responsibility to delegate that task to you. And that involves making sure that you are trained in the administration process, that you are supervised, and that you are monitored on a regular basis so that this is continuing to be done in a safe manner. Scope of practice will, as we said, depend on your province or your territory. It depends on your employer. It also depends on your training and your education. So what was included in your educational program. You are not responsible as a healthcare assistant to monitor the outcome of drug therapy. That is, you're not responsible to be able to look at someone and say, yes, this medication is working, or no, it isn't, although you may at times have good indication of that. We are not responsible as HCAs to measure or decide dosages, and we are never responsible to do parenteral medications, and those are medications that need to be introduced into the body by piercing the skin. So that could include subcutaneous injections, intramuscular injections, IV medications, even things like insulin that have to be put in with an insulin syringe. We are responsible for observing and reporting changes in our client's condition and behavior. So, anything that you would otherwise let the nurse or alert the nurse to still needs to be passed on to that nurse. A big part of our job is observing and recording and passing on that information. It is the nurse, the doctor, or the pharmacist who will do the education for the client with respect to their medications. They will teach the client how to take their medications properly, if that medication needs to be taken with food or on an empty stomach, how many times a day it needs to be taken, what things might need to be avoided, or what types of things might be combined with it to get the desired effects. While it's not our job to do the teaching, it is our responsibility, again, to observe, report, and record if we feel that that patient or that client needs additional education or needs reinforcement of the information that they did receive. We always have to be cognizant of the fact that the client always has the right to refuse to take their prescribed medications. We would never force medications on an individual. Our responsibility then would be to inform our supervisor of that refusal, possibly try and talk to the individual to see what the problem is, why they are refusing that medication, and then again pass that information on to our supervisor. Residents do manage and take their own drugs if they're able to, and as we said, that's called the self-directed medication management, and this is oftentimes where the healthcare assistant will come into contact with medication and assisting people in taking them. The person should have the ability, and we should encourage them to question any changes in their usual drug routine and anything that's out of the ordinary. If you or the resident have any questions about anything in the medication administration, it's important to stop what you're doing and to call the supervisor before you proceed. Medication errors are very difficult to treat. Once that medication is in the body, it's hard to get it back out. So it's always easier to stop, ask our questions, and then proceed once we're sure of the direction we need to go. When we're dealing with medications, and if you've ever had one of your own, you've probably noticed that labels are written in sometimes a bit of a different language for some people. What happens is we use a lot of medical terminology and abbreviations to formulate those prescription labels. So abbreviations are just a shortened form of a word or a phrase, and a lot of the medical terminology is based in Latin, so it can be difficult to just decipher. We use abbreviations all over the place in this fast-paced world, but the abbreviations for medical terminology can be a little bit difficult to decipher. It's important for us, the HCA, who will be assisting that person in reading those labels, to have a firm understanding of the common abbreviations that are used with respect to medications. Never guess about the meaning of an abbreviation. This may lead to serious harm if someone is supposed to be getting medications before meals and we get the ACPC mixed up and we're giving it after meals. The food that they've ingested may counteract or null and void the medication that they're taking. So it's always a good measure to ask our questions, make sure that we have a clear understanding of that label before we proceed. The next few slides are going to go through some common abbreviations and the meanings of them. It would be well within your interest to make sure that you peruse these and have a good understanding. There's also a glossary of terms at in the resource section of your program here that will give you a listing of more common abbreviations, even that's on the slide. That list should be able to be printed off so that you can have it for a resource for yourself. But again, if you're in doubt, call to the supervisor. We'll help you to make sure that you are following these directions accurately. So here is the first slide of abbreviations. Take a minute to read them over and to familiarize yourself with some of the common abbreviations that you may see either on labels or in doctor's orders associated with medication management. Medications or drugs are called by various names, and primarily there's two different types of name that a drug or a medication can be given. It can be given its generic name, which is actually the name of the chemical, the medicinal properties that are making up that medication or that drug. It isn't always capitalized because it is just the name of the chemical that the drug is primarily comprised of. And the generic name is used in all countries by all manufacturers. So the example that we've given here is acetaminophen. Acetaminophen is the active ingredient in the medication that actually does the work in the body. The trade or brand name, Tylenol, is what the company who makes Tylenol decided to call their acetaminophen product. So if you look on your box of Tylenol, acetaminophen, that name will also be on there in the form of its generic name. The brand name or the trade name is usually capitalized and followed by the registration symbol. It is owned, that name is owned by the manufacturing company. But basically, what the active ingredient is in Tylenol is acetaminophen. So how do medications work in the body? Medications enter into the body and cause a specific desired effect. We are given prescriptions to take for various reasons, and the hope is that the medication will either treat, promote health, or prevent illness. So we give medications to treat illness or pain, things like aspirin to help with fever or aches and pains. We can give things like stool softeners to promote health, with promoting regular bowel movement or regular elimination. And we can give medications to prevent illness. The example we have here is an antibiotic given, as we call, prophylactically with our surgery patients. They don't have an infection yet, but we know we've opened them up and we've potentially increased their risk for infection. So as a preventative measure or prophylactic measure, we oftentimes will order antibiotics to be given. Drugs get into the body in one of several ways, and the way that it gets into the body is what we call the route. So it's important to identify the appropriate route for any given medication. Is that medication to be given orally? That means it's put into the mouth, and that could be in the form of tablets or capsules or liquids, or sublingual where it's just dissolving in the mouth. There's a number of different means and measures that medication can be put in through the mouth. But if it's going into the mouth, it's considered an oral route. Topical route means it's put on top of, so top of the skin or the mucous membrane. This would include creams and ointments or transdermal patches. We could have a medication getting into the body through the inhalation route. And as the name implies, that person would be breathing that medication in. It would enter in through the respiratory system and either act directly on the respiratory system or be absorbed into the bloodstream and then distributed through the body via that respiratory system. We can put eye drops in eyes and ear drops in ears so that we can place medication directly on the affected body system that is requiring it. We have suppositories that can be placed either into the vagina or into the rectum, depending on the medication and the purpose of the suppository. And then we have parenteral routes, which is primarily a nursing responsibility, and these would include all of the different forms of injection. So with parenteral routes, we're going through the skin, which means we have a needle entering into that body. Anytime we have an invasive process like something foreign going into the body, breaking through that first barrier of defense, the skin, that responsibility falls on the shoulders of our licensed professionals. Once the drug gets into the body via whatever route we've used, the body then has to absorb that medication into the bloodstream. So if the drug gets into the body via the oral route, it needs to be entered into the mouth, and then it needs to possibly be swallowed down into the stomach, where the stomach acids will digest and break it up into its chemical compositions, and then it gets absorbed into the bloodstream in the small intestine. The bloodstream, then the circulatory system, then will distribute that medication to the body. If, for example, our medication was a topical medication, we rub that cream onto the skin. The medication is absorbed through the skin, again, into the capillaries under the skin, entering into the bloodstream. So somehow the body has to absorb that medication. The medication gets into the body and it gets absorbed into the bloodstream. The circulatory system then distributes the medication throughout the body, targeting the areas in which we are hoping that medication will work. As the medication is circulating in our blood, our liver sees it as a foreign entity. The liver is saying this medication, this chemical composition is not normally here, so I see that as an invader. And so the job of the liver is to metabolize or break down that medication, recycle whatever it can or wants from it, and then kick the rest out to be excreted through either urine or feces. So this is why when you take a Tylenol, in about 4 to 6 hours, you're going to be requiring another Tylenol if the underlying cause of your pain hasn't disappeared. In about 4 to 6 hours, your liver has filtered all of the blood and removed the acetaminophen and all of the other chemicals that came from that Tylenol, and your body is busy excreting those byproducts. So in order to get another effect from that medication, we have to retake the medication. There are some terms that you'll hear when we're talking about drugs and drug interactions, and you may hear terms like drug synergism. And drug synergism is when we combine two drugs, and the combination effect of those two drugs is greater than either the effect of either of those drugs alone. And sometimes we do this on purpose to augment or boost the effect that we're receiving, but sometimes it just happens and we aren't looking for that synergistic effect. And some of the synergism that can occur for people are extreme drowsiness or hyperactivity or an increase in nausea, those types of things. So it may not be necessarily a good thing that we have this increased effect. The opposite of that is drug antagonism. So this is a medication that when added with or combined with another, we see a lessening of the effect than as if it were given by itself. So they counteract one another or they interfere in each other's ability to do their best job. So the example that we've given here, an antacid might prevent an antibiotic or a birth control pill from being absorbed. And if we think about what happens, we're swallowing an antacid, it is going into the stomach, and as the name implies, it's reducing the acidity level in the stomach. If we're then swallowing our antibiotic behind that, and the coating on the antibiotic requires a higher acidic level in order to break it down so that it can be absorbed by the blood, by lowering the acidic level, we may interfere in the process of breaking that down. So these are just things we need to watch for, not that we can be aware of what's actually going on in that body, but we need to be observant and we need to be passing information on as clients report their symptoms or report some of their side effects or the effects of the medications that they're taking. And this might just be a question they can ask their doctor about taking different medications at the same time, taking them in combination, or would it be better to spread them out? That's a conversation your client needs to have with either the doctor or the pharmacist. When we talk in terms of desired effect, that is the effect that we are hoping to get by delivering the medication to this person. So if we're on an antibiotic, our desired effect is that that antibiotic will kill the microbiology that is causing an infection. If we have pain, the desired effect of an analgesic is that that analgesic will reduce the level of pain that we're feeling. Along with the desired effect always comes side effects. There is no drug out there that doesn't have side effects, although some of them are very mild and go seemingly unnoticed by the client. A side effect is an unwanted effect that the person will experience in addition to the desired effect of the medication. And some of our very common side effects that go along with a great number of the medications that people are on out there are things like dizziness, dry mouth, nausea, vomiting, constipation, diarrhea. These are just in addition to the actual desired effect. Now, sometimes these side effects can get quite serious, and we change the name slightly when they do that, and we now call them an adverse effect. Most of the time with side effects, people can live and push through it. We weigh the choices, the need to have that medication for its desired effect outweighs the uncomfortable side effects that they have. But when we move into adverse effects, these are more serious. They can have potentially harmful outcomes, and they may or may not reverse even once we stop the medication. So we always have to be mindful in listening to our clients, listening to what they tell us they're experiencing following their medication administrations, and we may have to alert their supervisor about the adverse effects that someone is having. People also can be allergic to medications, and an allergy is just an abnormal response to a drug. The body sees the drug as it enters into the bloodstream no differently than someone with asthma's body views pollen. The body tries to fight the drug. Antibodies form as a result of that, and allergic symptoms, can be produced in that individual. And the symptoms will range like other allergy symptoms from mild to severe. So they could have the rashes and itchy eyes and runny nose. It could move into fever, wheezing, a shortness of breath, weakness, nausea, and vomiting, or it can become very severe, causing drop in blood pressure and possibly even cardiac arrest. Anaphylaxis is the most serious form of allergic reaction, and it may be life-threatening. Anaphylaxis would require the use of an EpiPen and medical emergency services for the individual's best chance at survival. So how do drugs affect our body? Drugs can affect our body in one of typically 3 different ways. They can affect our body topically. That means they work on the surface of the skin or mucous membrane. So if you had ringworm and you put ointment right on that ringworm, it would work on that skin and just the skin underneath it, and that would be a topical effect. Drugs may also have a localized effect in that they're working on a specific body part or body system. So with our asthmatics, and they take their inhaler, that inhaler enters into that respiratory system, the system that is in need of some assistance, and so the medication in the inhaler works in that local area, primarily the respiratory system. And then we have the systemic effect, where we're taking medications really so that it works and affects the entire body. There is some small systemic effect in all types of medication because it is picked up by the bloodstream and it is delivered around. But with topical and localized, we're hoping that the primary effect will be in those smaller areas. Whereas your systemic effect, I take a Tylenol for my headache. That Tylenol actually flows around all parts of me. So if I had a sore toe, it would take away the pain in my toe just as well as it would take away the pain in my head. There are a number of factors that affect drugs and the drug action within the body. As we know, the same drug can affect 2 people very differently. We want to make sure that we're not doing anything environmentally that might change or affect the drug action. So we are always storing our drugs in a safe, dry place away from sunlight, following the directions on the label, and that's in the hopes of avoiding any chemical changes which might affect the drug action. Other factors from the client's standpoint that can affect drug action are the age of our client, how big they are, the gender of the client, what other disease processes do they have going on, the way that the medication is administered, so the route that's used, a PO or per oral drug, the drug that is put into the mouth, will take longer to get into the system than will an IV drug. So if we take our Tylenol through our mouth, the Tylenol has to be swallowed, get down into the stomach. It's got to go through the process of being digested through that gastric juices and then put into the small intestine where it's absorbed into the bloodstream. So that can take, 20 minutes, half an hour before that process actually goes on and the blood has actually got our acetaminophen in it. Whereas if we were to put that acetaminophen in through IV, that would be a very direct route, and it would be quite instantaneous compared to taking that Tylenol PO. So the route of administration often determines how quickly that drug goes into effect for that person. The emotional state and genetic factors, physical conditions, all of the things that are involved in that individual, that client, what they believe is going on, how worried they are about things, will all affect drug actions and how for them. So this is just a little introduction to assisting people with medications. It is a serious procedure. We are assisting people to self-medicate or manage their medications independently, and as such, we are kind of a second check for them. We must always work within our scope of practice, so never think that you can give someone an injection unless you've been trained and delegated to do that. You must always follow the policy and procedure of your agency or your facility, as well as following the governing legislation from your provincial or territorial legislations. If ever you have, or the client has, any questions, if you need clarification, it is imperative that you stop and contact your supervisor, get those questions answered before you proceed. We must always remember as well that as we are assisting our clients, it is our responsibility to respect the rights of those clients. Following this video, when you go back to your G2 learning system, there will be a link on the G2 system just underneath this PowerPoint presentation, and it's going to take you to a short YouTube video that's produced by Wondershare, and it goes through assisting with medications, some of the roles that you as the HCA can play. I hope you enjoy the video. Thank you.